When you think of a hospital, you picture sterile rooms, operating tables, and cutting-edge medicine. But beneath that clinical surface operates a massive, high-stakes warehouse, moving thousands of regulated, sensitive items every single day. Doctors use highly advanced medical equipment to treat patients, yet the system tracking those very same life-saving tools is often completely manual. Nurses and clinicians are forced to navigate this sheer volume of inventory by hand, writing out charge captures and preference cards on physical paper, or keying them into static spreadsheets. Relying on human memory and pen and paper to manage thousands of moving parts turns a place designed for healing into an administrative trap, highly vulnerable to simple human error. The first place this manual system breaks down is in the budget. When items are tracked by hand, expensive medications slip through the cracks, quietly expiring on the shelves before they can be used and creating enormous financial waste. Next, it attacks operational efficiency. Highly trained medical professionals end up spending hours of their shifts hunting through supply closets for misplaced tools or specialized equipment. The most dangerous failure point is patient safety. Inventory blind spots inevitably lead to sudden stockouts, meaning that critical supplies might simply be missing when an emergency rolls through the doors. Every manual data entry mistake compounds these issues. A missed keystroke or a lost piece of paper creates a cycle of logistical chaos that cannot be solved by simply hiring more staff. Escaping this cycle requires a complete change in how a hospital actually sees and manages its physical space and assets. Hospital Inventory Management Software, or HIMSS, is designed to solve this by creating a real-time digital map of the hospital's physical reality. This diagram shows how the system is built. The foundation is the data tier. This acts as the memory bank, automatically gathering raw information from external sources, legacy data warehouses, and connected devices into a single unified pool. Above that sits the server tier. This functions as the system's brain, acting as a central processing hub that continuously filters, organizes, and analyzes the massive influx of raw data in real time. Finally, the presentation tier sits at the top. It takes all that processed data and translates it into a clean, intuitive interface that a clinician can instantly read on a mobile device or desktop computer. By separating the heavy data processing from what the user actually sees, this three-tier architecture prevents medical staff from drowning in raw numbers, turning a chaotic flood of information into exact, actionable directives. To see how this works in practice, consider what happens when a paramedic needs to locate one specific piece of critical equipment, like an available defibrillator, across a sprawling healthcare network. Using RFID tags and unique generated barcodes, every physical device is mapped directly into the software ecosystem. This gives hospital administrators and ambulance specialists instant visibility on the exact location and operational status of that defibrillator, down to the specific floor and room. The software also runs quietly in the background to handle mundane tasks. It tracks batch and lot levels, sends alerts for approaching expiration dates, and constantly reconciles stock levels without needing any human intervention. This continuous automated visibility takes isolated, passive storage rooms and connects them into an active, life-saving network. With accurate real-time data, a hospital can transition to a just-in-time supply chain. They order exactly what they need, right when they need it, replacing the old, expensive habits of over-hoarding supplies just to avoid stockouts. Implementing this level of control does come with realistic friction. Rolling out custom software requires a significant initial financial investment, and medical staff accustomed to manual routines often resist the steep learning curve of a new system. However, using automated data migration tools to pull information from legacy systems ensures the new database is accurate from day one. Pairing that with tailored onboarding programs helps quickly ease user adoption. The temporary friction of installing the software and training the staff is a necessary trade-off to permanently eliminate systemic operational waste. Inventory automation establishes the financial stability and organizational order required to keep a modern facility running. By moving the high-stakes tracking of medical assets into a digital architecture, the hospital recovers vital hours for its medical staff. This clarity ensures that doctors and nurses can direct their focus back to their primary function, patient care.